Hello everyone, in this video let's see about the rehabilitation protocol for total knee replacement surgery. Before look into the protocol, let's start with the surgery. The total knee replacement surgery is also known as knee arthroplasty, where the knee is replaced by using prosthesis. The indication for this surgery include severe joint pain that compromises the functional ability, destruction of articular cartilage, marked deformity of the knee such as genu varum or valgum, or any failure of previous surgical procedure. The knee arthroplasty is classified by method of fixation, cemented and uncemented. In cemented, the components were held in a place with acrylic cement. The cementless fixation is a biological fixation that relies on rapid growth of the bone into the surface of porous coated. Before starting the physiotherapy protocol, as usual, we have to assess the patient's condition. For that, let's start with the subjective assessment, where we collect patient's personal history as well as present illness, and then continue to the objective assessment. Here, assess the patient's pain using visual analog scale, range of motion using goniometer, muscle power using Ashworth scale, and look for patellar immobility and soft tissue palpation. Remember, we have to assess the patient's condition before starting each and every phases of treatment. After assessing the patient's condition, let's draw the treatment chart. For knee arthroplasty, the treatment consists of three phases. The phase 1 is the maximal protection phase, the phase 2 is the moderate protection phase, and the phase 3 is the minimal protection phase. In the post-operative day, immobilize the patient's knee using knee immobilizer to prevent post-operative swelling. Remove this in day 1 of post-operative. So now we'll start from the treatment of phase 1. In this phase, our goal is to prevent post-operative swelling, minimize pain, restore muscle power from 3 to 4, and try to reach the range of motion of knee 0 degree to 90 degree of flexion. So we'll see some exercise for knee. First, straight leg raise. Start from minimal force with support. Second, adduction of hip. Try to do in supine lying. Next, abduction of hip. For that, ask the patient to lie in side lying. Try to do in midline. Then cord sets. For that, place pillow or towel under the angle. And ask the patient to give force downwards. Hold for a few seconds and then relax. Next, move to the treatment of phase 2. As I told already, we have to assess the patient condition first. In this phase, our goal is to mobilize the patient. For that, first start with strengthening of leg muscles. Use TheraBand for knee flexion and extension. Next, use resisted band for strengthening of thigh muscles. Ask the patient to flex the knee and hip and then abduction and adduction movement. In the day of post-operative day 3, after giving mild strengthening for leg muscles, train the patient for gait walking. For that, use walker or crutches. Train the patient in partial weight bearing. For that, ask the patient to place the unaffected crutch first and then affected crutch, then unaffected leg. Next, train the patient for chair squats to strengthen the leg and back muscles. For that, ask the patient to keep both legs in slightly abducted position. Then sit and stand. Next, move to the treatment of phase 3. This is the phase for minimal protection phase. In this phase, train the patient for walking without support. Also train them for active daily activities. Now, train our patient for stair climbing using cane for the balance. Train the patient for gait walking for the balance. First, straight walking. Do gait training twice a day for better improvement. Next, train patient in cycle ergometer. Now the patient is perfectly ready. Then instruct them to avoid jumping, stair climbing, overweight bearing, etc. Thank you.